Welcome back. Joining us now from Univera Healthcare is Medicare consultant Michelle. Hi, Michelle. Thanks for joining me.
Thank you so much for having me.
Of course. Why don't you start off by giving us a general overview of all the Medicare options available for Western New Yorkers once they turn 65?
Yeah, there are a lot. There's a few. And there's Original Medicare. And when we think about Original Medicare, we think about, Part A and Part B. We think about that Medicare card. And Part A is your hospitalization. And when we think of that, it helps the cost of inpatient hospital care, hospice, skilled nursing. And then there's Part B. Part B is medical. And that would be your outpatient, that would be your doctor's visits. And usually there is a premium with your Part B. Please keep in mind, though, there is no prescription drug coverage with Original Medicare. So you have to find a standalone Part D for your prescriptions to make sure those are covered.
Alrighty. So that was all the original Medicare option. How about Medicare Advantage?
Yeah. Medicare Advantage is what everyone loves. It's very affordable. Univera has some great plans. Actually, it have such really rich benefits. You have dental, you have vision, you have hearing, you have a free gym membership.
Oh.
And the great thing about it is it's an umbrella of all of it. It's also known as Part C, and it's Part A, it has Part B, and it has prescription drug coverage.
Okay.
So you don't have to go someplace to find that extra drug coverage because it's all in that one Medicare Advantage plan, once again known as Part C, because there's so many letters, right, to Medicare. People are A, B, C's, and D's. But your Medicare Advantage plan is Part C, and it's an umbrella of everything.
That's right. So that's how Medicare Supplement benefits the original Medicare plan then.
I'm sorry?
How does Medicare Supplement benefit the original Medicare plan?
Yeah, so that works with Original Medicare. That's a great question because that one's kind of confusing. If you're going through a lot of health issues, you're definitely going to want to look at a Medicare Supplement plan. That's also known as a Medigap plan. That helps pay what Medicare doesn't. For instance, if Medicare pays 80%, Original Medicare pays 80%, that Medicare Supplement is going to pick up that additional 20%, so you're going to be covered.
Okay, that seems like one of the best options.
Once again, prescription drug coverage is not included in that. So you would have to go to Medicare.gov, you can type in the prescriptions that you're currently using, and it will populate some plans, and you could then pick what plan best fits your needs.
Well, what is the first step to enrolling in Medicare?
I always advise people to call Medicare. Medicare, for your red, white, and blue card, is to call that Social Security Administration office.
Okay.
When you call Social Security, they're going to ask you some questions. You're going to get that red, white, and blue Medicare card. And then after that, you could then decide what plan is best going to fit your needs. You have a window. You have a 7-month window. So it's 3 months prior to your 65th birthday, the month of your 65th birthday, and then 3 months after. This is considered to be your initial enrollment period.
Mm-hmm. Okay. Now, what if someone decides to keep working after they turn 65? Do they have to enroll in Medicare?
This is confusing, and this is where everybody has tons of questions in regards to. So the key is if your employer has more than 20 employees, you can delay enrolling into Part B. And the reason for that is because that's considered to be credible coverage. Your medical and your prescription coverage is credible, which means you don't have to apply for that Part B right away. If your employer has less than 20 employees, then you have to apply for Part B, and Medicare becomes your primary insurance at the age of 65. Yeah, it's kind of confusing. And one thing to keep in mind, too, is that some of those plans are high deductible. And if people that are under 65, they could save some money by basically having Medicare be their primary insurance.
Now, do you want to talk more? You just touched on it. How does a high-deductible health plan affect HSA contributions?
Yes, if you do have an HSA, and if you're contributing to that, HSA stands for Health Account, Health Savings Account, I'm sorry. And in regards to that, if you have to stop contributing to that, because if you don't, you're going to get penalized by the IRS. So we advise you to stop contributing 6 months prior before you enroll into Medicare or accept your Social Security.
Michelle, thank you so much for coming in, because these are really great tips. Like you said, this is kind of confusing for people, so to hear those how you just broke it down was very simple, and we appreciate it.
Absolutely. Thank you for having me.
Of course, and viewers, if you would like more information on Medicare or to make an appointment with Michelle, visit univeraformedicare.com. Thanks again for coming in, Michelle.
Thank you.